Hello, everyone. Welcome to the first day of Creighton's National Public Health Week celebration. Mental health is today's theme, and it's an emerging key issue in public health. We know that 1 in 5 Americans experiences some form of mental illness. And not only is mental health something that impacts those individuals, but we also feel its ripple effects in other parts of society. Many people experiencing mental illness also have substance use disorders, are incarcerated, or may be homeless. Data has shown us that mental illness also impacts almost 17% of youth aged 6 to 17, and suicide rates for children ages 10 to 14 nearly tripled from 2007 to 2017. And we also know that 70% of youth in the juvenile justice system have received at least one mental health diagnosis. So that's why we're really excited about today's theme and helping you to learn how you might be an advocate in your community for mental health. So when you look into our blog today, you'll see a number of calls for action for how you can make a change in your community, including a pledge around stigma. We also have some resources around cultural humility training for providers who are working with diverse populations, and also just some general stats that you can share with friends and family. On that note, we have a great conversation today with a public health and social work researcher who's working on the topic of social support with breast cancer patients and their caregivers. Today's guest is Dr. Tess Thompson. She's a research assistant professor at the Brown School at Washington University. That's in St. Louis, one of our neighbors. Welcome, Dr. Thompson. Can you tell us a little bit about yourself, maybe about your educational background and how you came to this topic? We'd love to hear a little bit more about you.
Sure, thank you. Thank you so much for having me, and I'm honored to be a part of your National Public Health Week. My path to public health was kind of a winding path. I think a lot of us have experienced that. So my undergraduate degree was in English, and my first master's degree was in English as well. So I've always been drawn to stories. Even as an undergrad, I was active in Take Back the Night, and I was really drawn to the idea that it can be very healing for people to share their stories with others. So when I realized that I wanted to go back to school for social science research, I was really kind of drawn to the work that was being done at Washington University in their health communication research lab. And so it was about a decade ago now, there was a researcher there, Matt Kruder, who was looking at narratives and how stories can be used to promote mammography among African-American women. And so that was the project that drew me to Washington University. I got my MPH there and then went straight into their PhD program in social work. And so I've been working in cancer prevention and control pretty much that whole time. I started off by looking at stories, but then I broadened my interest into looking at the social context and how the social context affects health in cancer prevention and control. And I'm particularly interested, I started off by looking at couples and dyads, how spouses or other partners can provide social support to patients. But now I've really been broadening that and starting to look at the whole network of social support that a patient might have. And in particular, caregivers that provide a lot of informal, unpaid support. So that's what I'm working on right now.
Wow, Tess, this is a really diverse background you've got. I really appreciate your sharing that with us. A number of our students come from all kinds of disciplinary backgrounds and have got all kinds of experience that they're looking to apply to their public health practice. So that's really helpful that you walked us through that. In an earlier offline conversation that you and I have had, because we're collaborators, we talked a little bit about a project that you're starting to do now, and that's looking at African-American Black populations, the patients and their support systems in the broader social context. But can you tell for the listeners of ours, excuse me, that are not as familiar with breast cancer and particularly the African-American experience, like why that was an ideal population for you to work with and What's interesting about it? What's drawn you to working with this population?
Well, that's a great question. So breast cancer is particularly important because it's the most commonly diagnosed non-skin cancer among women in the US. And I'm very interested in breast cancer survivorship because it's great news that more and more women are surviving breast cancer, but that also means that you have a bigger and bigger population of survivors, tens of millions of people who may have long-term side effects and need to be monitored and make sure that they're still doing well and thriving years out from breast cancer. And we also see health disparities in cancer outcomes. So African American women and white women are diagnosed with breast cancer at roughly the same rate, but African American women are more likely to die from breast cancer. It's about 40% more likely. And that's due to a variety of factors. So there's access to insurance and healthcare, also the type of tumor, the choice of treatment, but some of the variants also remains unexplained. So it's interesting because some people will say breast cancer research breast cancer as a cancer has been overstudied, that we know a lot about social support and breast cancer, but when you really start to drill down, we know a lot about breast cancer and breast cancer survivorship among middle class and upper middle class educated white women. So when you look at the actual descriptions of samples in the research papers, a lot of times the authors will note in their limitations section that our sample was primarily white and well-educated and married. And so just not representative of the general US population. So when you look at African-American women, when you look at sexual minority women, you find that there's a lot we still don't know about breast cancer and the breast cancer experience. We do know that informal caregivers are really important in providing support to women with breast cancer. A lot of that research has looked at spouses, but there are differences in marriage and family patterns in different racial and ethnic groups in the US. And so it's really not clear that findings from well-educated white women apply to the general US population. So there's a lot more work that needs to be done to make sure that all breast cancer patients and survivors and their caregivers are supported. So the project that I'm working on now, I've asked women who African-American breast cancer survivors who were a few years out from their breast cancer diagnosis to refer an informal caregiver. So somebody who is unpaid and provides social support. It could be emotional support. It could be like help taking people to appointments or giving them food or meals when they are recovering from surgery. So I've asked them to refer an informal caregiver for focus groups to find out more. And so even just in the last couple of months, I feel like it's been so helpful in hearing from a variety of perspectives. So as I mentioned, a lot of the research that has been done in primarily white samples focuses on spouses, so patients and their husbands, and because it's usually a heterosexual sample as well. So when I asked people to refer whoever was their most important support person, the first several focus groups, the first 19 people I talked to were not spouses at all. So I talked to mothers and daughters and friends and sisters. And so really realizing that if you're focusing on spouses, you're missing this whole beautiful network of support, and you're not even seeing that. And so it's been just such an honor to hear some of these stories about how people have supported patients through cancer, but it's also been really kind of moving to hear the stories about how the caregivers needed support themselves and didn't really get it. And so that's what I'm moving on to in this next phase, is thinking about how can you provide support for caregivers? One of the tricky things is a lot of the caregivers will say they don't want support, especially when the patient is in active treatment, because their focus is on the patient. They want to make sure the patient gets through and they'll take care of themselves later. So there's a question about, are there ways, if the patient is getting radiation or chemo, that the caregiver that's come with them could maybe get a healthy meal or have a chance to work out, or even just a quiet room to sit down in. So just things like that that you can provide as part of treating the patient, where you can also help the caregiver as well.
Well, I mean, that's really helpful, Tess, the way that you've broken it down and helped us think a little bit about breast cancer as a diverse range of experiences rather than one sort of way to go. So that's I think helpful for those who are still learning about cancer of all kinds, but particularly breast cancer. And if you're interested in some of the local stats here in Douglas County, there's some good reporting out from our Komen, Nebraska has their report out that gives some of these stats about what the breakdown looks like here in Douglas County and around the state. So if you're interested, please take a look at that. So thinking about our next question, I know earlier you and I were chatting offline about some of the work you're doing, and you're already starting to think about some of the things, the patterns and themes that are starting to emerge from your work. And I know that on your campus, there's also a really great cancer center that's also done some really great research and had some interesting findings. Do you want to share a few of those with the group so they understand a little bit more about what's happening and how unique these experiences are?
Sure. So one thing that I've found in my work is that a lot of breast cancer patients and survivors, African-American women, white women, generally do very well. So that's the good news, is that a lot of patients go through treatment and then they get back to the rhythm of their daily lives and are able to thrive. One thing that we've seen, though, is that there's a smaller group of women that really are struggling and could use help. And that's for patients and caregivers as well. And so I think it's really important for healthcare providers to be screening for some of these psychosocial factors. So for asking women about whether they're feeling depressed, asking people about whether they have social support at home, and then trying to think about what they can do to fill in some of these gaps. So whether it's support groups or finding online resources, trying to find ways to connect to the people who need help with help. So I know at our cancer center, for example, we have psychological support services where they can talk for free to a psychologist if they're feeling distress. So I started working with the psychological services department at the cancer center. One interesting thing they told me is that they've been doing distress screening for all of the patients that they see. And they see both cancer patients, and they see about, I think it's about 20% of their patients are caregivers who are experiencing distress. And so they've found that the caregivers are actually more distressed as a group than the patients. And so I think that really speaks to the importance of caregiving and also the stresses of caregiving. So probably a lot of people watching this have been a caregiver or know someone who's been a caregiver, and they know that it can be really wearing. It can be very intense. And so it's so important for caregivers to, if they need help, to be able to try to find the help they need. So that can be asking somebody else in the family or asking a friend to step in for a little bit if you just need a break. It can mean asking for mental health support if you need it. So one participant in one of the focus groups that we had said that she went to, it was a special event where they asked patients and caregivers to come, and they had food and they also had information. She heard a doctor talking about some of the signs of depression, like feeling tense and irritable, having trouble sleeping. And she said it was a revelation for her because she hadn't really thought that she might be having mental health trouble. And so she saw that as a sign that she needed to reach out and get help. And she was talking about how in the community where she grew up, there's a stigma or an assumption that people don't need help. And so it really was like flipping a switch for her to realize that maybe she did need help and she could ask for it, and it could help her get better. And so I think that's a really important thing for people to think about. One thing that I've also seen is that a lot of times during treatment, the caregivers are really focused on just getting the patient through, getting them better. And then it may be afterwards that they realize, wait, I've been going nonstop for months and months, and I need to find a way to get back to normal for me. So a couple people had mentioned that their health behaviors really took a nosedive at the time. So they weren't able to exercise, they weren't eating well, or they were stress eating. So really thinking about, once treatment's over, how can they get back to what their normal is and make sure that they're taking care of their own health now that the patient has recovered.
You know, that's really helpful to hear. Like, I don't think that as we think about the difficult journey that folks have to take through cancer treatment, I don't think we always hear this caregiver side of things, the complicated relationship they have, just the amount of distress and stress they might also have themselves. So that's an important takeaway, I think, for our audience, regardless if they're public health care workers or not. It might be something to think about if you've got a caregiver in your life, to maybe check in and see how they're doing. One of the things that you talked about earlier is about these cancer inequities that were happening with African American populations. And although they were being diagnosed at roughly the same rate, we had this 40% almost difference in outcomes for these ladies. And so I wanted to ask you a little bit about, many of our students are interested in health issues that are around healthcare inequitable outcomes, and they want to do that work, and they want to work with those diverse populations that might be experiencing these inequities. Do you have any advice from a public health perspective about how those folks might think about how to get started, or what they should do, or what kinds of things should they have in their mind as they're embarking on doing this important inequity work, but also want to be respectful of the populations that they're working with?
That's a very important question. I know you and I have been talking about the importance of cultural humility, and I think that's really key, especially when you're starting out, not going in and thinking that you have all of the answers. Or even the right questions, because sometimes you really have to be having conversations with people and groups that you're working with to be able to ask the right questions. So I think that it's really important, especially for people who are researching populations that they may not be members of, to be really cautious and mindful of their own position to the work. And so, for example, we see a lot of disparities by socioeconomic status. And so I think it's really helpful for researchers to think about their own, well, positionality is a research term that I know you're familiar with, but from qualitative research. So research that uses interviews and stories as opposed to just numbers, really emphasizes thinking about who you are as a researcher and what your relationship is to the topics that you're researching. So I think that's really important. I know for me, reading scholarship from Black women like Dorothy Roberts, and I have to give a shout out to her book, Fatal Invention. It's a wonderful book looking at race in the US and how it's socially constructed. So I think really thinking about the scholarship developed by Black women has been important for me. Thinking about citing Black women. And then when I go to submit an article, choosing reviewers who are Black women, just to make sure that I'm really engaging with some of the scholarship from African-American women in this area. I think that's really important. I also think having teams that are diverse along a variety of dimensions is really important. And not just having diversity, but also inclusion and equity. So not just who is in the room, but how are decisions being made? Whose voices are being heard? So it's very important for me, as I'm working with researchers from a variety of backgrounds, to make sure that I'm allowing myself to be guided by collaborators. And again, not coming in thinking that you know all of the answers, making sure that you're working together as a team. In St. Louis, we have the St. Louis Breast Cancer Community Partnership that brings together community organizations, and working with them has been very helpful. I think it's very important for academics to show up in the community and not just come in with our own research projects that we want help with, but to know what's going on with other groups, what services they're offering, what needs they have, and try to be a good partner, not just coming in to do your research, but really trying to develop shared goals and work towards those shared goals. So with the St. Louis Breast Cancer Community Partnership, it's been really helpful to think about what are our shared goals as a group, what are we working together to achieve, and then it becomes less about individual people and their own goals, but more of a shared community goal.
I really love Dorothy Roberts. I'm really glad you brought her up. She's one of my heroes. But that's really helpful to hear that being an active listener, being culturally humble, really getting those partners through from the start and the end of the process sounds like it's really integral to your work. And those students of ours that have taken community-based participatory research, some of this language will be familiar to you. And if you've not, we'll link an article in the resources for you to look at if you're interested in sort of these broad principles of being community engaged and what does that mean, and being place-based and community partnered. Those are important principles that we here at Creighton would like to uphold, and hope that you're doing that as well in your work. So before we wrap up here, I wanted to give you a chance to give us any final thoughts or any feelings about mental health or about the cancer populations you've been working with, or anything else as we end our conversation today.
Well, I'd like to start by thanking you again for having me and letting me be a part of your National Public Health Week. It's been a pleasure. I think I would like to just close by saying that the illness experience can be really difficult for patients and their caregivers. So if people in the audience are going through that now, or know people who are, just know that there are resources available if you need them. There are community mental health resources that I'm sure you can provide that are locally applicable. But if people are struggling, there is help available online or locally. And so it's really important to reach out and ask for the help that you need. For students who are interested in working in healthcare settings, I think it's really important to keep in mind people's psychosocial needs when they're going through illness, and also just other needs as well. So financial is really key when people are going through cancer treatment. So of course, the first priority is helping patients get better and attending to their physical health. But a lot of these psychosocial needs are really important as well for patients and caregivers. So I would really encourage students who are interested in working in healthcare settings to just keep in mind the whole patient and the whole caregiver, and the importance of the relationship between the two.
Thank you so much, Dr. Thompson. This has been a really great conversation to have with you. It's a really great way to start off our week. We're thinking about the whole person. In our Jesuit values, we talk a lot about curus personalis, and we really think about the whole person. We really think about from start to finish, from body inside to outside to their environment. So this is a really great way for us to start off our week thinking about the whole person. I think your talk really brings that into the right framework. And so I'm so grateful to you all. And those of you who are watching this, make sure to look at some of the resources we have available on our blog and in our social media. They'll help you get into the right direction if you want to share some resources with friends and family or patients you're working with. Those will help you get started on the national level, and most of them have links to things that are local. So if you're looking for something in your hometown, in your community, there's likely a link within those larger national websites that can help you get started. So thanks again for listening, and have a great rest of the National Public Health Week.